Hi, good morning.
Okay. Hi, good morning. It's Baze. How are you?
I'm well.
So are you on your way in right now
No, I'm actually sitting at
to
my
meet
desk. So I
this?
actually I literally just walked in and sat down at 6:45 here in the morning, and I need to go check on the OR to see make sure they're set for the day.
So as you're looking things over, what kind of day do you have ahead of you?
Oh, very, very busy day. And so my partner's doing a couple procedures. I'm going to poke my head in next door. I have a little in-office procedure. I have 5 patients who are seeing me for preoperative consultation. So these are patients that have been scheduled for surgery. And I like to go over the general plan, make sure I've answered all their questions. And then I have just kind of briefly glancing at the schedule, looks like almost 10 new patients. So that's a busy, exciting day
Wow.
for us.
It sounds like such a much heavier schedule than I imagined.
It's busy. Like I said, starts at 6 a.m. It'll probably end around 6 p.m. tonight.
This is Dr. Stephen Williams, a Northern California based board certified plastic and reconstructive surgeon. Over the past 2 decades, he's built an exceptional career that includes a few history making moments. Dr. Williams was the first Black graduate of Yale's plastic surgery program in 2005. In 2023, he became the first Black president of the American Society of Plastic Surgeons, an organization that's been around since 1931. When he's not tucking tummies and lifting faces, he's often invited to give talks about his two passions, health equity and the ways technology is reshaping plastic surgery. He's watching the field evolve from every angle and monitoring it online where it seems to be everywhere. Think multi-part breast surgery, recovery TikToks, celebrity facelift reveals, and think pieces mapping the many new looks influenced by plastic surgery. Everyone has their own opinions and experiences with plastic surgery, but in a world where those conversations are getting louder, more visible online, more casual, more candid, is plastic surgery really in a new era? I invited Dr. Williams onto the podcast to cut through the noise. I started by asking what's changed most in his practice over his 20-year career.
I think that plastic surgery overall has become more accepted, not only acceptable, but almost in some ways expected. And the aesthetic space is also getting more and more sophisticated. And I think patients have a higher expectation about the services they're receiving. Part of that means quicker recovery. Part of that means, minimal scars.
Dr. Williams also says one of the biggest changes in his practice is how patients think about identity. They want to alter their features, but not erase them.
In my opinion, one of the best things that's changed is a very custom tailored ability to match what they want. And so in the old days, people got one nose to the point where there was a mold that we would use when we were training, and it's still sold today. And it had exactly what you were supposed to shape the bones and cartilage like. And you had this little model, and you would kind of do it, and you would kind of hold it up to the patient. And it's like, okay, I did it. And I think now that's becoming much less accepted. I think that as physicians, as plastic surgeons, we're listening to what our patients want. I think that we're preserving ethnicity. We see that a lot in our Middle Eastern patients. We see that a lot in our African American patients. We see that a lot in patients of Hispanic heritage, that they don't want to have their ethnicity wiped away. They want specific refinements that align how they feel on the inside with how they want to look on the outside. But it doesn't mean this cookie cutter one size fits all. And I think that is amazing. Now, it requires us to, first of all, listen to our patients, which I think has been something that we've gotten better at, but we haven't always been great at.
And this seems like it's somewhat influenced by a new generation. There's the generation that probably trained you when you were young, and then there's the ones that are coming up, and you're kind of in this sweet spot of like experience meeting the moment. So it's really interesting.
Yeah, I'll give a little bit of pushback on that. I think that generally you're correct. There is kind of the old guard, but I will say that plastic surgeons are innovators. And I think that we respond to pressure probably more quickly than a lot of our colleagues. And part of the reason why is because there's a market aspect. If we don't respond to what people want, then all of a sudden we are not busy plastic surgeons anymore. But I think moreover, I do think that as my generation of plastic surgeons has come of age and become more influential, that some of the things that we saw that maybe weren't great for patients. One size fits all. Hey, I'm not going to listen to you. I'm the doctor. I'm going to talk to you. You sit there and listen and then sign up. Those things have no place. And I think as people like me start getting gray hair, it becomes more and more part of the culture that, of course, we don't do those bad things. Of course, we listen to patients.
Dr. Williams says plastic surgery is a field driven by innovators. So I wanted to know,
is there like a single innovation that made you realize that we've entered a new age of plastic surgery recently?
What a great question. And so there are a couple things that I would say. I think that techniques always evolve, but the days of coming up with a physical surgery based around traditional techniques that's completely innovative is probably gone. And so the plastic surgery kind of went through relatively clear evolutions, and they were unfortunately almost always backed or initiated from war, because patients would come back with these horrible injuries, and plastic surgeons would have to try to figure out how to make them better. And so things like skin grafts, very kind of basic concept, but then this concept of, well, maybe not a skin graft, maybe we can move tissue from one place to another to manage a defect or manage a problem. And then this concept of like, oh, wait a minute, if I get out the microscope, I can move tissue from almost anywhere to almost anywhere. Those are definitely evolutionary points in plastic surgery where it opened up a whole new world of tools, a whole new world of techniques to help patients. I think the days of those types of things are probably not gone. I think the last frontier in that is actually being able to create tissue in a jar from your own cells and then putting it back in you that you could really use to help patients. In the interim between kind of the days of microsurgery and robotics, which we're kind of still in, to the days where we're able to kind of tissue engineer. I think the other thing, and I'm not trying to be long-winded here, but I think the other thing that has been a major impact in this kind of in-between times for these major plastic surgery epics is probably social media. And part of the reason is it's really been a transformation about where patients are looking for answers.
patients may be scrolling through their feeds for information, but the images they're exposed to might be pushing them into a doctor's office. A recent Boston University study found that the more time users spend on social media, the more likely they are to want a cosmetic procedure.
Social media definitely creates unobtainable aspirations, but there are some things in terms of bringing people together and building networks that's been very, very positive for medicine as a whole. It's allowed patients to coalesce and build community around things that maybe they were afraid to ask their doctor or talk to their friends and families about. And it's really generated this ecosystem where patients feel safe to express their personal desires for how they want their outward appearance to be and understand, at least to some degree, what some of those journeys look like. We're on the cusp of being a really big deal is AI, artificial intelligence. And when I'm speaking around the country about AI and plastic surgery, I tell people that it's going to mean that patients have less and less of a realistic expectation because the realities now are less and less real.
And while more and more artificial images circulate, there's still a constant stream of plastic surgery-related photos, digital stories, and trending topics to consume, like Ozempic face. It's been a big focus online all year.
We have so much media now. There's like a million articles about all of these topics, and then there's like kind of the need to brand the topics. And so Ozempic face, Ozempic body, these are buzzwords, and they've been used in a lot of articles. Is there anything you think that the media could handle differently when it comes to starting to use these buzzwords and talk about like products associated with Ozempic face or procedures for Ozempic body?
Yeah, super sophisticated question. I think that typically buzzwords are used as a placeholder for sometimes more complicated topics and ideas. And I don't hold the media responsible for ensuring that every buzzword is completely vetted. I think that train has left the station. 30 years ago, 40 years ago, I think print media, radio, and television was an incredibly important way to disseminate information into the American body public. I think that is essentially gone now. I think that we all rely on silos that we built of information that resonates with us. So what I would tell patients is, don't jump on every fad. Everything you hear on social media isn't necessarily true. And at some point you have to take some of those ideas, concepts, and things you've heard and bring them to a plastic surgeon and say, what is real and what is not real?
One very real challenge doctors face now is misinformation. Falsehoods can easily spread like wildfire.
You're talking about this with your patients in your practice, but do you also feel more responsibility to sometimes address things publicly as well?
Absolutely. Every plastic surgeon loves being invited to talk about their breast augmentation techniques or their facelift techniques. I'm no stranger. I love doing those. But I also really try to lean into topics about social media. I really try to lean into topics about AI because they have an overall societal effect that directly impacts our patients. And in my practice, the bulk of my patients are female. And I think it's important to recognize that traditionally females in American society don't get great healthcare and don't have great outcomes. And what can we do as a society in plastic surgery and in overall healthcare to address that? I think that's incredibly important. Otherwise, we're being derelict in the things that we have been charged to do, which is to take care of people.
You mentioned social media and expectations. You also mentioned it with AI, which is going to, like you said, exacerbate it. But do you find yourself now kind of counseling patients about maybe a potential gap between their expectations and the reality of what could be done?
Constantly. And so, we'll have patients bring in pictures and say, I want to look like this. And we say, that's not real. And, 10 years ago, it was Photoshop and those types of things. And so social media was getting more and more popular. But now it's face tuning and things that are really, really subtle and sophisticated that are really harder to notice. And part of it, again, is patients are living in this world where they expect to be young forever and there's never any scar or complication. And as a good physician, it's important that you take care of patients. And part of that means, explaining to them the real impacts of plastic surgery.
There's the issue of what can and can't be done. But what happens when AI starts delivering its own version of peer review?
What's really, really interesting is we are not that far away. I would say maybe 6 months to a year from AI being able to judge your work. I'm not trying to promote one system over another, but it'll be very interesting when those systems not only say, well, here are the things that are different, or here are the things that are below the standard of care or could represent a complication. And I have reviewed 500,000 of these cases, including reviewing 500,000 before and after results. By the way, I have within my lexicon of knowledge every single plastic surgery article that's been written in the last 60 years. And I know every technique. Not only that, but I know Dr. Williams, and I've found some of his before and afters online, and then say, here's where I think they made the mistake, and here's what he should have done differently in the operating room. It's going to be very interesting to kind of see how we navigate that. And I think as, for my plastic surgery colleagues, a lot of them, maybe me, we're not ready. AI is going to tell the patients who the best plastic surgeons are. AI is going to tell patients why they shouldn't go see a plastic surgeon. And again, very interesting time to be a physician.
As you're thinking through these possibilities and also what's possible now, are there any ethical or cultural questions that come to mind that plastic surgeons will need to think about in the next decade, maybe even the next 5 years or 3 years, based on what you're saying?
Yeah, or now. I think that patient expectation is always an issue. It has become more acceptable and more prominent to think about preventative types of treatments.
We're seeing and hearing from people in their 30s and 40s that are coming in for facelifts, which is just so much earlier than what we used to think of the facelift patient being. And, this idea of preventative surgery or preventative treatments. Do you think that we're getting any closer to accepting aging, or is this just us getting better at disguising it and hiding it?
Yeah, it's a great question to ask a plastic surgeon. I think it depends on the amount of arc of time that you're going to look at. But as we're living longer and longer, I think people are looking to the future and saying, well, wait a minute, I'm not going to be in a nursing home when I'm 60. And so I want to look like I feel. And so sometimes that does mean earlier care. And again, we want to be agents and supportive of patients, but we have to make sure that they're doing it for the right reasons. It's important that we have ethical boundaries about what's appropriate to offer patients without being paternalistic. And that's the hard line to walk. When a 17-year-old comes to me and it's like, my parents are in the waiting room, they know I'm here, I want Botox. And I'm like, why do you want Botox as a 17-year-old? I don't want any wrinkles. Like, well, how do you know you're going to get wrinkles? Like, you're preventing something that you may not even get. And so it's important to not take away a patient's agency and to not take away their autonomy or to project your standard of beauty upon them.
He says preventing that is pretty simple. Plastic surgeons just have to go back to the basics.
And so that really starts with the oldest tool that physicians have, which is a conversation. It's really just sitting down and talking to the patient and trying to explain and relate and interact with those patients. And so, what is old is new again in some ways.
It seems like it's so important with all of the information, the content, the opinions, to be able to really have a good conversation.
There is a lot more data. There are a lot more treatment pathways and paradigms that you have to consider and communicate. There is also generally a patient population that's more exposed to the ability to know and ask about some of these things. And they have expectations that they're going to have things explained to them. I think the gap for patients is they don't always recognize or understand how complicated some of these things are. Medicine is still something that's evolving, and each human body, each human system responds a little bit differently to the treatments that we prescribe.
The practice is evolving, the landscape's evolving, and so is the patient. Can you talk about the way the type of person that is seeking surgery has changed over the years?
Yeah, I think, again, one of the most rewarding things from my standpoint is patients are more advocates for themselves. They really have a much clearer idea that they can ask for very specific types of things and get away from the cookie cutter things that we were talking about a little bit earlier. I think that, at least in my practice, and part of it may just be who I am and the things I speak about, but there's definitely a larger diversity of patients who are seeking care. And, for me, that's really rewarding. Whenever I tell this story, I'm just very touched at this African-American nurse who came to me, and she was an ER nurse, and we had worked together for 10 years of, getting these calls at 2 a.m. It's like, hey, Dr. Williams, can you come in and sew up this little girl who has a dog bite? And she finally came to me and said, I think I want to do something for myself. And we kind of came up with a plan for her. And I remember after things were done and she'd done great, she just said, I never thought that I deserved this. I never thought this was something that was right for me. I thought that looking the way I did was my curse for the way I lived my life. And I didn't realize that these types of things were for me. And that was just so hard for me to hear in that moment, because I think it's easy to ignore some of those barriers or to not recognize some of the things that hold certain parts of the population back. And it's not just aesthetic surgery. When we kind of look at the numbers about African-American women who get breast cancer reconstruction, why is that number so different than other populations? And part of it is the patient themselves, part of it is socioeconomic reasons, part of it is physicians, and part of it is the overall healthcare system.
I still sometimes wonder, how do we view plastic surgery? And I'm curious, do you see it as something that is still a bit of a class privilege?
Yes. And for a couple of reasons. It's not just necessarily the cost of surgery, but it's time off work, time away from your family. And if you're making $18 an hour and you live in San Francisco or New York, guess what? You don't have time to take 2 or 3 weeks off to recover from surgery, much less find the money to scrape together to have the surgery in the first place. And so at some level, it's still aspirational. At some level, it's still out of reach for a lot of people. And when you look at, there's patient financing and things like that, that still saddles people with a whole new level of debt that can be oppressive. And so, unfortunately, yes, there are still people who would benefit. There's still people who we think would be amazing patients, but they're excluded because of the socioeconomic barriers.
I don't know if you could answer this, but I wonder if as it becomes more widespread and in demand, does that help the cost? Does that, if it becomes more mass, is that something that could potentially lower the cost in certain areas?
It does a little bit. The challenge is there are fixed costs. It costs a certain amount to have a safe anesthesiologist. It costs a certain amount to have high quality instruments that are sterile every time for the patients. And we are subject to inflationary pressure just like the rest of the world.
Well, one last thing I wanted to ask about is this idea of undetectable procedures, because that's, there used to be this facelift look, and you could sort of assign it to a certain group. And so therefore, maybe you didn't feel you needed that, because it's well, that's what these women over here on 96th and Park or wherever, that's what they do. And so it kind of removes you from that. But now with undetectable procedures and surgery everywhere, how do you interpret that? Do you think of it as progress, or is it now a new kind of pressure? And then therefore some people can afford it?
It's another level of access, right? It's another challenge, because generally plastic surgeons, myself, a lot of my really wonderful colleagues around the world are doing amazing work. And a lot of things we think about are like, oh, here's a little bit of a change about how we can hide scars. Or at my practice, scar therapy is a really, really important part of what we offer patients because we want the scars to be as fine as possible. And so there is a certain status to that. Maybe, whereas you might find cheaper plastic surgery in other places that maybe is more stigmatizing or maybe is associated more with those things that patients don't want.
We talked a lot about the ways that people come into surgery, social media, asking people questions, asking the doctor. But what is a question someone should ask themselves before getting plastic surgery?
Yeah. It is a fantastic question. And so, the first thing is, why are you doing this? What are you trying to achieve? What is the overall goal? And generally, what is true is plastic surgery doesn't save marriages. It doesn't make you rich. It doesn't necessarily make you happy. Sometimes patients say, well, am I going to be happy? And I say, I don't know. Your tummy's going to be flatter, and if that makes you happy, then that's great. But happiness is a really complicated thing that we all strive for, and it's multifactorial. And so I think being honest with yourself about what would really align my outward appearance with how I feel inside, and am I okay with the risks and scars and the downsides that come with those surgeries. But I think that's an honest question that everyone should have with themselves, because any doctor that says that any treatment is completely benign or has no downsides or side effects is not being honest with you. Everything has a side effect. Everything has a risk. Most of the risks are very, very minor. They're very well tolerated. We built a very safe practice, which has been a blessing, in all honesty. I don't use that word a lot, but that's definitely like the fact that my patients have done all so well. But it's still important to understand the risks. So.
What does it feel like to feel like someone's putting their happiness in your hands?
Yeah, it's a lot of responsibility. But it's something that you go through with patients. And again, I said it a little bit tongue in cheek, but you are still managing that, right? When you look on the outside, as you feel on the inside, there is something uniquely human about that connection, that alignment, that really does help people to be in a happier place. It helps them to be better. And unfortunately, society does have certain standards on age and beauty. And again, unfortunately, it affects women much more than it affects men. We have lots of patients that come to us say, I've got to get a facelift because I'm getting back into the work environment. And again, that's, as a physician, I'm sad that society feels that way, but it's great that there is a pathway, if that's really what is going to make someone happy, that we can provide that as a service.
I went into my chat with Dr. Williams curious about the major changes in plastic surgery culture since he entered the field over 2 decades ago. By the end, I was thinking that the more things change, the more they stay the same. Sure, there's much less secrecy around medical aesthetics now. The techniques are getting better and better, and a broader range of people are booking consultations and procedures. The practitioners have definitely evolved too. I am here for all this empathy and emotional intelligence. But the desire to meet impossible beauty standards, it's really nothing new. The pressure's just coming from different sources, and the goalposts keep moving. But if Dr. Williams represents the new guard, it's clear that as a culture, we'll never be over talking about going under the knife. I want to thank my guest, Dr. Stephen Williams, for his beautifully sculpted commentary. Reflections is produced by Emma Myhre, who says she never wants to go under the knife. That's why she never leaves home without applying sunscreen. Follow us on Instagram at ReflectionsWithB for updates and a behind-the-scenes look at our work. And if you liked this episode, please share it. We really appreciate it. I'm Baze Mpinja, creator, writer, and host, and I know exactly what procedures I want to get in the next 5 years, 10 years, something like that. We'll be back soonish. Thanks so much for listening.